Hi, I'm Dr. Jeremy Pettus, and I'm an endocrinologist at UC San Diego that conducts clinical trials for new therapies for people living with diabetes. And I wanted to take a second to tell you about one particular study that is a little different than most. Why is that, you ask? Well, it's because we're actually testing the effects of marijuana in people with type 2 diabetes. Now, why in the world are we studying this, you might ask? And it's a good question. The reason is that while it's widely known that marijuana increases food consumption, getting the munchies, it's also been known for a long time now that people who routinely use marijuana tend to be thinner, have lower cholesterol, and are less prone to developing diabetes. Additionally, with marijuana now legal in most U.S. states, millions and millions of people with diabetes are using marijuana products. However, it remains exceptionally difficult to study marijuana in clinical trials. So there's this huge gap between how many people are using marijuana and what we know about the effects on metabolism and diabetes. So we designed a study to help close this gap. We now have a research grant through UCSD to prospectively study the effects of marijuana in people with type 2 diabetes. The study looks like this. First, to be eligible, you have to be between the ages of 21 and 70, not currently on insulin, and not regularly using marijuana. The study consists of 10 study visits over 3 months. We will conduct procedures to determine your degree of insulin sensitivity, weight, cholesterol profile, glucose metabolism, and more at the start of the study, and then repeat these procedures after you've been smoking marijuana for 2 weeks, and again after smoking placebo for 2 weeks. In other words, everyone will be given marijuana for 2 weeks and placebo for 2 weeks, but in a random order. The marijuana is provided by the National Institute on Drug Abuse for research purposes. Compensation for time and travel provided at each visit will occur. And again, I just think this is an interesting study and a chance for us to learn more about the effects of marijuana in type 2 diabetes. If you meet the inclusion criteria and would like to enroll, or you just want to hear more and ask some questions, please reach out to my research group at T1D Research at ucsd.edu. And thanks for listening.